This is a message that I want to share with workers, is that your unconscious bias is showing. And we talk about unconscious bias when we talk about anti-racism stuff, but you can apply the same principles to transphobia, to shame against substance use. And these are substance use workers, harm reduction workers who just say the most vile things and most passively aggressive things about the people they work with, and we see it. Stop doing that.
I recently was in a car accident. The doctor who saw me in ER, at the very end of this write-up, he said issues and addictions, which had nothing to do with that circumstance. And that just goes to show you even healthcare from that, it's everywhere. It's addicts are completely marginalized. They didn't need to add that in there because I have a history with addiction, because I was honest with my healthcare provider. That felt really shitty.
I want you, my physician, to respond to me where I'm at and help me with my health care. But instead, he fixates on the drug use as if that were the only thing that I was there for. And often it's not. And that kind of stigma and that kind of attitude is very common in my experience. I've experienced it in different avenues, not only with the medical profession, but with mental health. Even when I went to get help for substance use, that attitude was there, right?
It's important that your healthcare provider knows everything about you, just so you're able to talk candidly, because you can miss out on your care, on certain aspects of yourself when you dim that out. You dim out part of you, you dim out your care,
I don't think that they knew what the heck they were doing at all, but I think they did the best that they could for me, and I'm here talking about it, so I feel constantly grateful that I made it and that I'm okay.
I'm a survivor of conversion therapy. I am a survivor of the mental health system. All of these things that need to be put into account as someone who also uses substances. That kind of redirects the attention and brings a lot of bias and unwanted attention on a certain issue. On the flip side, I have a really great doctor. Really great doctor. She listens to me. She kind of addresses the things that I bring to her without too many why are you asking that? Or we can't really do that for you. It's very a proactive, engaged relationship that we have together. I can bring multiple issues to her in a single appointment, and she can help address each of those issues in a single appointment. A radical idea to have in healthcare. I remember coming out to her as someone who uses crystal meth, and she's like, okay. And then asked me a few more questions. She's like, okay, we'll keep an eye on that. I'm like, great, that was wonderful. It's a relationship that works. It's based on trust. It looks at me as someone other than someone who uses substances. And I think that's what works. She's looking at my holistic health. She's looking at me as a person, not just someone who is taxing the healthcare system.